So we're going to begin with the back. I'm going to just let my client take a few deep breaths here. I want to make sure I'm aware of just her natural breathing pattern, so that when I'm doing my compressions, I'm not pushing on her while she's trying to breathe in. So as she exhales, I'll be able to sink into the tissues. I can move more laterally or away from the diaphragm as she's inhaling. Or just make sure that I'm not forcing her rib cage to collapse at least. You can do a nice little push for the sacrum, stretch the back out a little bit. Your positioning on this can vary depending on, what you're comfortable with as far as your wrist go. You don't want to deviate too much or put too much pressure, and try to keep your wrist as neutral as possible if you're going to do that. Okay. For undraping the back, usually depending on how warm it is where you're at, you may just undrape the whole torso, leave the sheet covering. That gets the blanket out of the way. I'm going to use my lower hand to establish either where the mid-sacrum is, top of the sacrum, mid-sacrum, or where their undergarments are. If they're not wearing undergarments, you simply palpate down to the mid-sacrum, and you pull the draping back, secure on each side as you let their hands out. If they are wearing undergarments, you say, Ruby, is it okay if I tuck the sheet in your underwear? Okay. So you just ask permission. That way you can establish, where her garments are. Ruby, is it okay if I move it down just an inch to have access to your lower back? Okay. You do still want exposure to the mid-sacrum. This is really important to actually access the low back muscles. Now notice, I pulled the draping more down on the outside of the hips. This way the waist doesn't pull the draping up, since it typically would cinch. Okay? This also allows you access to the muscles of the hip, which are technically glutes, as you all know. Alright. First effleurage, just applying oil. Second effleurage, we're beginning to sink into the fascia. Third effleurage, we're beginning to get into the muscle bellies, and you can go a little deeper each time. Okay. More figure eights. Now, I'm going to get a little extra oil for my arm. Well, for her arm. Okay. As I was saying, this is an easy way to also access the tricep group if you like. Anyhow. I'm going to work my way from bottom to top, doing one side of the body at a time. So that's how I'm going to begin first. Now, long gliding strokes. As you can see, I'm keeping it very fluid. Figure eights, across the length of the back and across the lower back. You want to do this, we always say 3 to 5 times for repeating strokes. That's usually what it takes for the muscles to get nice and warmed up and very relaxed. Okay? So I'm going to work from the top of the hips here. I'm using a very soft fist. Very soft fist. You can use some thumbs. Thumbs can be pokier than the soft fist. So I even keep those moderate. There's usually a lot of tenderness, just inferior to the iliac crest in the upper glutes. So you just want to be considerate of that you're not working too fiercely in these muscles, okay? Figure eights for the QL. You can find the iliac crest and dig right in beneath the erector spinae group. You can do some QL figure eights. Okay. Do some petrissage for the lats. Again, just working bottom to top. Now, I know I may not be following the sequence verbatim at this point. That's okay. If you want to do these techniques verbatim, you can. One of the key things is that you just want to make sure you're flowing from one technique to the next and not working too deep, too quickly. And of course, that you have a sort of order to things. Okay? You can do petrissage along the erector spinae group here. Little circles. So I'm just bracing the pads of my fingers with the other hand, doing little circles, pulling the tissue away from the spinous processes, away from the center, away from the center, away from the center. This will help decompress the muscles and allow them to let go. Slow, specific, short, and circular, okay? Some scapular circles here. You can do rotator cuff, get out to the rhomboids. You can even alternate between the two if you'd like. What happens if you do too many of the same stroke of one area? It begins to feel annoying after 3 to 5 times. So kind of going, if you really on an area that you can feel is sticky or something like that, you may do a few techniques, connect with another thing, and then get back to readdressing it. To transition, I'm going to use some thumb glides. This technique feels very, very nice. Okay. Some broad strokes. This one's tricky, but it's nice. Your outside hand pushes down the rhomboids. Okay. Notice I'm addressing the upper trapezius, levator scapula, and rhomboids. Right? Splenus capitis and cervicus, right? Out. My thumb is tracing the spinous scapula here. So it's really getting the trapezius, all the different muscle fibers, and then I just follow through back to the occipital. Outside hand down, inside hand out. Bring it back to the occipital. Okay. Some nice neck petrissage while I'm up here. Okay. Maybe I give this side some thumb glides too, just to have a nice transition. I'm going to keep going with those long figure eights. Again, having a pump is a little bit more useful because you can simply just pump and can get right into your treatment again. Let your arm go for me. Thank you. Again, notice I did that with just a little bit of oscillation, having her arm let go. Say hi to the triceps while I'm here. Alrighty, and now again I'm going to work bottom to top, just like I did on the other side. Everything I did to that side, I want to make sure I do to this side. Remember the intent of Swedish is to sort of restore balance, allow the client to relax. So you just want to make sure it's not too much of focus work and that it's very fluent. And it's just giving the client a chance to sort of feel where their body is at. This is great for someone's first massage. It's definitely, you know, what I think, it's definitely like a good recommendation for somebody's first massage, just to get a full body Swedish, a general relaxation. That way it's not anything too intense. And they can get a sense for what to expect in a treatment. Get into the cue well, you find the iliac crest, work your way under the erector spinae root till you feel the 12th rib. You can just figure eight back down. This can be really intense for some people. I mean, it's great muscle to address for lower back pain. At times this can be really too intense. So if you have a difficult time finding the QL, or if you're still unsure how to work it effectively, it does take time. It's really, I find that it's common that it's a tricky thing to palpate and to actually work in gently. So, you know, just a little practice will get you there though. It's nothing too crazy. Okay, so I can see your shoulder has begun to shrug a little bit, just because I've sort of been working the tissues out of compression. So I just want to get back to sort of neutralizing the joint. Scapular circles throughout the rotator cuff and also around the shoulder joint. Connection back to the top. Again, that technique, your outside hand pushes. So first I stabilize the occiput. That's something that should be noted. And then the outside hand pushes down. Inside hand comes across, tracing the spina scapula. You change body positions so that we can pull up. That one's, you know, a little bit complex. I mean, it's still Swedish, but it's a fun one to learn. It feels pretty good. It's really effective. And this area in here, people always want work in the upper back, neck and shoulders. This is a really, really dynamic technique, but it's gentle enough to, you know, work without sort of hurting the client or getting in some of those sort of nasty trigger points in there. Okay, so it's a great sort of warm-up stroke. There's a little bit of traction involved. It's really nice. Wanted to do some friction or vibration through the rhomboids. This typically feels really, really good. Some nice the occipitals. Work the temporalis if you'd like. Some other petrissage techniques you can do for the back. You can do some torsion throughout the erectors. Just make sure you're not pressing directly on the spine. Okay? Just make sure, again, if you do one direction, that you also do the opposite. Now, as you can see, a technique like this takes some time. They all take time, but just remember you can't always fit every technique. Well, you can't fit every technique into every massage. So whenever you're choosing a technique, make sure, you're using some discretion. And that will develop and improve over time over which techniques are best for which types of tension, which clients. That comes with experience. I am going to effleurage out. I'm going to start deep, and I'm going to get gentler every time. Third one I usually use just as a sort of step-by-step redraping, allowing connection. Take a deep breath for me. Little craniosacral hold. Redrape your client, one fold. Alrighty, will you take a deep breath for me? No strokes. Get all the bad vibes out. Alrighty, that completes today's session. You can take your time getting off the table and dressed, and I will be back in a few minutes with your water.